Welcome to Pregnancy and Birth Diaries. Our today's topic is Hydatidiform Mole, commonly known as molar pregnancy. It's a rare and abnormal condition that happens during pregnancy. Unfortunately, someone very close to me had this recently, and I am sharing this with her consent and her informational support. Hydatidiform mole is a unique condition because the mole, the tumor, originates from gestational tissue that is formed during pregnancy, the placental tissue, and not from the maternal tissue. And it can metastasize, not always, but it is possible. Hydatidiform mole happens because of an anomaly during fertilization. There are two types of this condition: complete and partial mole. In a typical scenario, an egg contains 23 chromosomes and is fertilized by a sperm also carrying 23 chromosomes. But in the case of a complete mole, an egg that is fertilized has no genetic material, it's empty, it has no nucleus, but the key is it gets fertilized by a sperm cell that duplicates its genetic material, which means it contains an extra set of chromosomes. So in total 46 chromosomes instead of the usual 23. And this can happen due to a mistake during cell division in the process of spermatogenesis. This could be caused by different factors like genetic mutations, errors in the division process, or abnormalities in the chromosomes themselves. Another possibility is an empty egg getting fertilized by two normal sperm cells expressing only paternal DNA, which also makes up 46 chromosomes at the end. And these two rare coincidences lead to developmental anomaly and proceed as a complete hydatidiform mole. And it is important to note that in this case, there's no fetal tissue. Since there was no maternal DNA, there's also no embryo. However, in the case of partial molar pregnancy, there is some fetal tissue because in this case, a normal egg with maternal DNA containing the usual 23 chromosomes is fertilized by either a duplicate set of chromosomes passed on from a single sperm cell or by two separate sperm cells. So now the fertilized egg has a total of 69 chromosomes and not the usual 46. There's also a possibility of an egg that contains an additional set of chromosomes, so not 23 but 46, and when this egg is fertilized by a normal sperm cell, the result is the same, having a total of 69 chromosomes. And this causes partial molar pregnancy, chromosomal abnormality, in which in turn leads to development of abnormal placental tissue, and there isn't a viable fetus developing. Instead, abnormal tissue grows into the uterus, forming clusters that may look like grapes or cysts. This abnormal tissue is made up of cells that would typically develop into the placenta during a normal pregnancy. But in a molar pregnancy, this tissue grows abnormally. The symptoms of a hydatidiform mole include vaginal bleeding in the early stages of pregnancy. This is the most common symptom. In one study, 84% of patients said that they had bleeding in the first trimester, which happens normally due to the molar tissue separating from the uterine lining, endometrium, and the blood might look like prune juice. There's also severe nausea and vomiting, abnormally enlarged uterus, like the belly, and there might also be high blood pressure. However, as I have mentioned earlier, this happened to someone very close to me, and she did not have the typical symptoms. There was no bleeding or any spotting. She didn't have nausea necessarily, but she felt hungry all the time. She had normal appetite, but she didn't feel satiated, and she craved fatty foods, and she noticed an unusual dryness in her mouth and slightly enlarged belly. But she didn't pay much attention to it because it was her third pregnancy and bellies usually are a bit bigger. And she had a partial hydatidiform mole, which was noticed by her doctor during her ultrasound checkup. So this condition is mostly diagnosed via ultrasound that reveal characteristic grape-like clusters in the uterus. And blood tests measure high levels of human chorionic gonadotropin, HCG, which is a hormone produced during pregnancy. But in case of molar pregnancy, the levels are way higher than it would be for different stages of pregnancy. Once the diagnosis is confirmed, a surgical procedure is performed to remove the abnormal placental tissue from the uterus. In both cases of Hydatidiform mole, there's usually no viable pregnancy, and it all has to be cleaned really well to make sure that the mole does not spread into other organs. And then a tissue biopsy is also performed to know the type of mole. After the procedure, the regular blood tests are done to make sure that the HCG hormone levels are dropping steadily until zero, to know that the abnormal tissue has been removed completely. It is, of course, very challenging and sad condition. Not only you have to cope with the loss of pregnancy emotionally, but also deal with the fear of cancer. But generally, the prognosis is positive. Most women recover fully after treatment and have successful subsequent pregnancies. But there's a slight risk of recurrence in future pregnancies, so it's essential to follow medical advice and consider contraception for a specified period post-treatment. Okay, so Hydatidiform mole is a complex condition that requires prompt medical intervention and close monitoring post-treatment. And obviously, early detection, proper diagnosis, and appropriate treatment is crucial for ensuring the best possible outcomes. So again, it's very important to have regular checkups and seek medical attention for any unusual symptoms during pregnancy, and consult with your doctor if you have any questions or concerns in this matter. All right, that is it for today. Stay well, and I will see you next time.